So hopefully you got the videos from last week. I also scanned, I was able to get my scanner working, and there's a few supplemental handouts that might be helpful to study that I'll be sending out to you. So those would be coming, excuse me, later. When I convert this video, I will send those handouts. Okay, so when we left off, and I'm trying to remember, I think I was somewhere around here, but to review, because we're going to be doing reproduction next, and when we talk about the ovarian cycle or the heat cycle, really the hormones in the pituitary, which we talked about, FSH and LH, are what time the cycle. Now, within the ovary itself, which is in the abdomen attached to the uterine horns, the ovaries produce hormones. But usually, like I said, there's pituitary hormones, and then there's their target or their satellite organs, which the ovaries produce estrogens, progestins, and relaxin. So those are produced by the ovaries. So you need to know which ones are in the pituitary and which ones are in the organ itself. Now, the estrogen is the primary female hormone. And when the follicle is stimulated, the ovarian follicle under FSH, follicle stimulating hormone, the follicle has an immature oocyte, basically a cell, an egg cell, and it's going to be developed. And as it grows, estrogen is going to grow. And it's going to release. So estrogen and the egg grow together. The bigger it gets, the more estrogen there is. What also happens is LH is going to start to grow. When LH peaks, and that's made in the pituitary, we know the follicle is mature, and then when ovulation occurs, ovulation is release of the ovum. Now, after the egg is released, there is, think about the follicle, it's kind of like a sac. This will make more sense next week, but the follicle, when it ruptures, it's going to release the egg and it's going to seal itself off. And when that empty sac is sealed, it produces something called progesterone. The sac is called a corpus luteum. So a corpus luteum is an empty follicle. And when the egg is released, the body assumes pregnancy is going to occur. Now, we obviously know animals come into heat. Women, when we have our period, that time of the month, you release an egg. Pregnancy doesn't always occur. You release an egg and nothing happens. If the animal becomes pregnant, then the corpus luteum is going to stay intact. It's going to stay intact and it's going to keep producing progesterone. If for some reason the egg is released and there's no pregnancy, then eventually that's going to shrink and go away. So progesterone is known as the hormone of pregnancy. The progesterone pregnancy. Progesterone, kind of the words sound similar. As long as pregnancy is going on, that is going to stay intact. Now, you can use progesterone as an injection, and it can affect the cycle and it can affect pregnancy. But I'm primarily talking about progesterone that's natural in the body, that's naturally occurring progesterone. Okay, so remember, progesterone comes at the end. If we were doing monitoring, if we wanted to find out, did a dog become pregnant, we could test progesterone. We could draw some blood and check progesterone levels at breeding. And we know that if in about 2 to 3 weeks progesterone drops, then pregnancy didn't occur. It's probably one of the fastest ways that we can detect, was there a pregnancy? Now, you probably only do this in like high-end breeding or cattle or horses, maybe high-end canine breeders. Most of the time, you just see, do they develop mammary tissue? Is the animal getting bigger? But if you're really wanting to know, you will draw progesterone. If you draw progesterone at the beginning of breeding and you draw it in 2 to 3 weeks and it's right here, then we know there was probably a pregnancy, and hopefully that makes sense. As long as it's equal to when they became pregnant, then we would know there was probably a pregnancy. So I think progesterone, pregnancy. Now, relaxin comes in later, and this makes a lot of sense because when the fetus is fully developed and they're ready to give birth, relaxin is going to be released, and it's going to relax all the ligaments around the birth canal, and it's going to help with mammary development. So this one comes in later when they're ready to give birth, and it's going to relax everything. Okay, so let's move on to the kidneys, which we've already talked about this, but yes, well, that was a good timing, Sean. You can relax now and think about relaxing. But the kidneys produce erythropoietin. Now, you have to understand what is the feedback, what is the reason erythropoietin is released. It is stimulated by hypoxia. Hypoxia is low oxygen. So when the hypothalamus, I've kind of explained this, but I'll re-explain it. When the hypothalamus detects low levels of oxygen, not enough for you to be like gasping for breath, but even minute levels, when red blood cells die, you don't have as much oxygen carrying capacity. Erythropoietin is going to target the bone marrow. And basically, new red blood cells are going to be released from the bone marrow. And then what happens is new red blood cells enter circulation, more oxygen is carried, oxygen levels go up. So increasing oxygen levels decrease production of erythropoietin. This is the feedback system, like your heater detecting that your house is cold, your heat kicks on. When your heat comes up, your thermostat shuts off. When it gets cold again, it detects cold, it kicks on, adds heat to the house. Do you see the flux in temperature triggers the thermostat? No different here. The flux in oxygen in the body is going to trigger erythropoietin. So a lot of people, the error that students make here is they tell me that the target of erythropoietin is the kidneys. It is produced by the kidneys. The target is the bone marrow. Now, what I've mentioned before is that if you have animals in kidney disease or in kidney failure, a lot of times those cats are anemic. And there's lots of reasons for anemia. Hopefully you've been going through this in ClinLab 1. You should be going, because there's lots of, when an animal has a low PCV, and they come up with a low pack cell, and again, I want to say pack cell is 35 to 50 on average. If you're getting into like 30, 25, 20, 15, okay, we got to figure out why. But there's multiple reasons. You know, I mean, if they got hit by a car and they have a hemoabdomen, that's why you don't have circulating blood, because it's in the abdomen from a trauma. If they have autoimmune disease, sometimes the immune system attacks the red blood cells and kills their own red blood cells. That's the reason they're anemic. Sometimes they have primary bone marrow disease. Animals can have bone marrow disease, and the bone marrow is deficient. In this case, the animal's kidneys are not able to produce erythropoietin, therefore they do not replace the red cells. So as red cells die, their numbers just keep dropping and they're not being replenished. Now, if people are wondering, like when we had this cat, you know, we saw a lot of renal failure cats, and I worked with this cat one-on-one so much that I don't ever really forget the case. Now, we ended up doing 3 transfusions on this cat and can't do really more than 3. And what happened was there is a human synthetic erythropoietin, and I'm trying to remember what it's called. There's a drug, and it's like erythropoietin, and they give it to people. We were able to get some from a human hospital and try it. So you can try it. It didn't end up working in this cat. Its efficacy is iffy. But the lady's like, can we at least give it one try? We did. Unfortunately, then we put the cat to sleep because it didn't work. But I want you to understand, what is the feedback? Where is the hormone produced and where is the target? Now, a few other lesser hormones. I've talked about gastrin, which is produced in the stomach wall. So again, the stomach is not an endocrine organ. The stomach is a digestive organ, and again, the kidney is a urinary organ. It is not a endocrine organ, but some of these organs do produce hormones. It is produced in the stomach wall, but what happens, remember, when food hits the stomach, then basically gastrin is going to stimulate hydrochloric acid and those enzymes. And it's also going to help the muscles of the stomach contract. So gastrin is going to be, what is the feedback? The presence of food. It targets itself, the stomach itself, to basically help start digest a meal. Now, if you remember too, I talked about, and these, I did not, on number 12 on your homework, I did not have gastrin or secretin and cholecystokinin, because I kind of talked about these when I talked about the digestive system. But if you remember, secretin and cholecystokinin, they are in the duodenum. And basically, when chyme leaves the stomach, the first place it enters is the duodenum. And especially if it's acidic, high in fat, or high in protein, these two hormones will give feedback to the stomach, and it will increase, it'll help neutralize the acidity. So it releases bicarb, helps release more digestive enzymes to help basically digest the meal, high fat, high protein, high acidity. And it also will slow down stomach secretions. I'm going to skip over the placenta because we talk about that in reproduction. So I'm skipping over the placenta. Now, the thymus, the only thing I'm going to mention about the thymus, and we may have talked about this a long time ago, I wasn't able to do the lecture on the blood and immunity because we ran out of time first term, but the thymus is in the mediastinum, and it's an organ in the chest that's large when they are young, and it shrinks as they age. But it helps produce the T lymphocytes. So there is thymosin and thymopoietin, similar to erythro. Remember, anytime you see poietin, it's production of cells typically. So a lot of times poietin, there's leukopoietin, erythropoietin, thrombopoietin. I mean, any of the cell lines have a poietin. Thymopoietin helps produce or helps stimulate the thymus, but this occurs more when they are younger. So that's all I'm going to mention about that. Now, melatonin, the pineal body, is basically the part of our brain, and it's kind of like our sleep cycles, the timing of the clock, but basically it produces melatonin, and it helps with the sleep cycles, awake cycles. The other thing that I'm going to talk about next week is estrus is the heat cycle. Some animals are seasonally polyestrous, meaning they're under the influence of what season it is. Horses, for example. So their cycles are kind of timed by when it comes in the spring and the early fall and the sunlight. Some high-end breeding facilities in their barn will use lighting that mimics sunlight to try and force them to go into more heat cycles. Because in the winter, a lot of that, because of the sunlight, slows down. It picks back up in the spring, but by adjusting the light, they can kind of influence that. Naturally in the body, it would be melatonin, that would help time that. And I know a lot of people, I've never done it, but I know there's melatonin chewies, there's melatonin that you can take to try and help with your sleep cycles. I don't know how well it works. I don't usually have a problem falling asleep, but if people take it, it's supposed to help with that cycle. Now, the last one that you'll hear about, and especially coming up into when you take, okay, you guys do have Pharm 1 next term. I think you guys do have pharmacology next term. Naturally in the body, there's hormone-like substances, not a true hormone, but they act as a hormone. It's called prostaglandins, and they are tissue hormones. The interesting thing about prostaglandins is they are produced locally and have their effects locally at the tissues. And there's, skin, intestine, brain, kidney, lungs, reproductive organs, eyes. They're found in a lot of different organs. But basically, a lot of these are triggered in inflammation or injury. And that's where we do this. So it can influence blood pressure, blood clotting, inflammation. Now, when there is a lot of inflammation from surgery or an injury, and if you guys have ever heard of, and a lot of you have pets, we use a drug group called NSAIDs, non-steroidal anti-inflammatories like Rimadyl, Duramax, Metacam, Onsior. There's a group of drugs that are anti-inflammatory because when prostaglandins are released, they cause this inflammatory process. Now, some inflammation is needed for healing. Okay, so all healing begins with inflammation. But if it persists, it can actually cause some pain and delay healing. So when we put animals on anti-inflammatories, we're trying to minimize the effects of these prostaglandins. But what can happen is it can affect blood clotting. NSAIDs can actually thin out the blood to some degree. It can cause some GI bleeding. It can cause some kidney and liver enzyme elevation. So there are side effects to the NSAIDs that we have to be careful of. But you're going to hear this brought up in pharmacology, and I want you to know they're tissue hormones that act locally. Okay. So, are there any questions about that? Oops. Okay, and everybody can see this slide, or it's not a slide, it's the homework sheet. Oh, I lost my chat screen. Can everybody, it says not from me. I don't know what that means. She meant to quote. Oh, gotcha. Yeah. Whew, I gotta drink more coffee. Okay. So I'm just gonna go over some of these questions. Boppin, if you have any. Basically, if we say, what is the ultimate goal of the endocrine system? It's basically to work together with the nervous system to maintain homeostasis, to really the balance of all body functions. And then what is the difference between an endocrine and an exocrine gland? An endocrine gland does not possess a duct and it secretes in the bloodstream. If it's an exocrine gland, it has a duct. And what they have in common is they secrete on an epithelial surface. Their secretions have to be deposited on the surface of something. Okay, and the endocrine system, it is secreted in the blood, and then those hormones travel. So mammary gland, sweat glands, all exocrine endocrine secretes in the blood. So everybody understands the difference. And remember, think exit, exocrine. It's got to exit via a duct. And something wants to exit the body. Something needs to exit the body. How does the endocrine system respond to achieve homeostasis versus the nervous system? Now, just remember, the endocrine system is slower to react, but its effects last longer. The nervous system reacts very quickly because the nervous system sends a message via a neurotransmitter, which is a chemical, and it's sent down the nerve. The endocrine system's messenger is a hormone, but it has to travel through the blood. So the blood has to travel farther distances. That's why it takes longer to achieve its effect. So nervous system is fast, but the effects don't last as long. Endocrine system takes longer, so to speak. What is a hormone and how does it exert its effect on a cell? Does it have an effect on every cell in the body? So a hormone, the definition is a chemical messenger, but it only exerts its effect when it reaches its target organ or its target area, and that target has a receptor that only matches that hormone. Okay. It has to find it. So for example, when I talk about erythropoietin, the bone marrow is going to have a receptor for that hormone. Erythropoietin isn't going to have an effect anywhere except where it needs to. Okay, ACTH, which is released in the pituitary, has receptors in the kidney. That's the target. Does anyone not understand that? Actually, I might. What is meant by negative feedback and positive feedback? How does the body know to provide positive or negative feedback? Negative feedback is initiated by rising levels of hormone in the blood, and positive feedback is initiated by lower levels of hormone. Remember, there's a base level in the blood. It's being monitored by the hypothalamus. When the hypothalamus detects that hormones are low, it sends a releasing factor to the pituitary. The pituitary sends a factor to the target, and the hormone is produced and released. When the hypothalamus detects things rising, hormone levels rising, it's going to send an inhibiting factor, and it's going to inhibit production. Goes to pituitary. Pituitary sends an inhibiting factor to the target organ, and hormones are stopped, released. So it's kind of like this is the thermostat. Positive and negative feedback is like our thermostat. When your temperature in your house is getting too cold, the thermostat, which is your hypothalamus, is going to detect that the house is cold. Its target is the furnace. It's going to release a signal. The furnace kicks on. Heat is added to your house. The thermostat detects that now we've reached temperature. It sends an inhibiting signal, or it stops the signal to the furnace, and the furnace turns off. So if anybody does not understand this positive, negative feedback, please say something or let me know. And then it says, where is the hypothalamus? And maybe it would be beneficial for me to well, now I can't get out of this. Okay. You probably have your questions in front of you. But basically, remember the hypothalamus and the diencephalon in the brain, and it controls the actions of the pituitary. Now, the pituitary is the master endocrine gland, but it is controlled by the hypothalamus. Remember, the CEO versus the plant manager. You've got the CEO, which is the hypothalamus, basically owns the company, is basically in charge of everything, but the pituitary does all the work for the CEO. So the hypothalamus tells the pituitary what to do. The pituitary basically controls all the activities, and all the satellite organs are kind of like the managers of the individual departments, but they all report to the plant manager, who reports to the CEO. So it's kind of like a hierarchy, similar to a company. That just helps me think about this a little bit, maybe make more sense. And for number 7, a releasing factor causes the pituitary to release a hormone. An inhibiting factor causes the pituitary to stop releasing. Now remember, I said there are names for the releasing factors and inhibiting factors. They have names. But for the most part, I wanted you just to know the main hormones. All you need to know is that if a releasing factor is sent, it's going to release something. You need to do that in the positive feedback system because you need to release or add. The inhibiting factor comes in when we have the negative feedback system because you need to stop or not release a hormone. Okay, does that make sense? Now, what is the pituitary gland? What happens in the anterior and the posterior? So remember, if you look at the pituitary gland, it's basically one structure. But if you remember, I said there's 2 separate glands. It looks like one. Inside, there's 2 separate glands. You have the anterior produces and releases hormones when stimulated. So this is slide 11, which is important because it explains. And then the posterior pituitary is caudal, and it basically stores hormones and releases them. So only the anterior portion produces and releases. The caudal is storage. And remember, the hypothalamus produces 2 hormones, produces ADH and oxytocin. The hypothalamus produces those, but it sends it to the posterior pituitary for storage. Again, the CEO is too busy. He's like, look, I made them, but I don't have time to release them. So you need to release them when I tell you. And that's ADH and oxytocin. So make sure you understand which ones are anterior and which ones are posterior, and know the posterior does not produce. It only stores and releases them. Okay. Now, it said on number 9, the question, it said, be able to identify the following hormones and their function. Okay, for number 9, this is basically pertaining to slide number 12. So number 9 pertains to slide number 12. And these are all produced by the anterior pituitary. So they're produced and released from the anterior. Now, obviously, growth pertaining to metabolism of all cells, rate of growth in the body, prolactin for lactation. Okay. TSH should be pretty self-explanatory, thyroid stimulating hormone. Now, a lot of these anterior pituitary hormones, they have 2 functions. They basically promote the growth of that, if it's somatotropin, it's growth in the body. If it's thyrotropin or thyrotropic, it's growing and maintaining the thyroid. But it can also signal release of thyroid hormone. So it stimulates the growth and development of a gland, but it also controls the release of the hormones of that gland. So it's kind of twofold. ACTH, which in the name it tells you, I believe I told you in the first week in anatomy how important terminology would be to you and learning how to break a word down, because sometimes if you don't necessarily understand the word, maybe you don't, maybe you're sleeping right now, or you were sleeping the day I talked about this, and you're just like, that's a big word, I don't know what she's talking about. Adreno adrenal cortex trope growth hormone. This hormone, adrenocorticotropic, or ACTH, basically stimulates the growth of the cortex and releases some of its hormones. I'm going to be sending you a picture. Where did I put it? Here we go. Hold that thought. It looks kind of confusing. Now you get this picture in lab, okay? It's going to basically a picture like this. And it talks about the adrenal gland, the hormones, and the cycle. On the sides in these boxes are not pertaining to our test. These are the different blood tests that you can do to test for adrenal hormones and adrenal function. I'm only, for anatomy purposes, I'm only concerned with this middle circle, but it explains that the hypothalamus controls pituitary. Stress will cause blood cortisol to be low because stress consumes cortisol. So when cortisol drops, the hypothalamus sends a releasing factor. The anterior pituitary secretes ACTH. ACTH will go to the adrenal gland. After that, it'll stimulate secretion of cortisol. Cortisol levels go up. Basically, then the negative feedback starts and then it stops. Basically, if we have an animal with any type of adrenal disease, there's different tests along the way that we can test ACTH, we can test for cortisol to see where is the problem. Is it an ACTH problem? Is it a local problem at the adrenal gland? So when you get this picture, I just wanted you to understand it's not the testing in the boxes on the outside of the handout. Again, you'll get that in lab. I just like that handout that she gives. That's from Miss Gray. And it just explains that whole process fairly well. Okay, so we have ACTH, FSH, follicle stimulating hormone. The target here, so target here is the adrenal cortex. Target here is the thyroid gland. Target here is the mammary tissue. Do you see? Now growth hormone, the target's pretty much the body. That doesn't have like one spot. FSH, if in the female, the target is the ovary and the male is the testicles. FSH, now I always think of FSH more as a female hormone, but the males have a response to that. LH, target is the ovary, primarily also the testicles. Okay, melanostimulate 1, you didn't need to know for the test. Okay, and then the posterior pituitary, which 10 and 11 pertain to the posterior ones. It says 10, what is antidiuretic hormone is when it's released. Antidiuretic hormone basically is slide number 21. So really number 10, you get your answer in 21. Slide 21. Prevents diuresis. Why is it released? It's released when it gets feedback, there's potential dehydration. So if the hypothalamus detects dehydration, it's going to release ADH. ADH's target is the kidney. It'll cause the kidney to retain water or to reabsorb water at the level of the nephron. And then that water gets reabsorbed into the bloodstream. Hydration improves. Stop making it. So an animal, think, that is deficient in ADH, basically there's no stimulus to retain water, they're going to keep urinating. So the primary clinical sign, I really want to say some people on the urinary test said the primary clinical sign was polyuria. It's really polyuria and polydipsia, because if they're urinating more, they're typically drinking more. So usually the one follows the other. So I really like those. Most of the time, those symptoms go together. Most of the time in animals, that's PU is PD. Very rarely are they just PU. So it's PUPD, polyuria polydipsia. For number 11, which will be slide 22, oxytocin, it causes uterine contractions and milk letdown. So the animal already has milk production in the gland. When we do reproduction and we do lactation, the milk is up in the glands. And what this hormone does is it moves the milk from the upper gland to the lower. It's called milk letdown. When the animal starts to nurse, it triggers that process. Now, in women, and I can say, I mean, you know, we're women here. I breastfed 2 kids. There's reports of women, and I can tell you, you can hear a baby crying. It's not your baby, and I could feel my milk rushing. It's a natural. It's like a process. Or when I knew that it was close to time for my kids to eat, you could feel it move. It's very interesting. But so it's a very similar process. I understand lactation a lot better after having 2 children. But oxytocin, so normally it's stimulation of the teat that causes that, but there can be some nervous impulses that cause it to happen. And that can happen as well. Okay, so we've got 10 and 11. Now for number 12, these are ones that are produced at the target organs. Okay, so when we get into, now on slide 23, it's mainly the thyroid gland, but we're talking about the hormones that are produced outside the pituitary, which is in the target organs. Ones that there's a few on here that I did not put down on your homework sheet and that you need to write down. Let me put one note. Let's see, that's on number 12. So I'm going to add it to the email, but the hormones that I did not, I'll just type them in the chat screen because usually someone wants me to repeat it. So let me just type the ones that are not on here. So I just typed in the chat screen for number 12, the additional ones that we talked about that I wanted you to know. Remember T3 and T4, and you can know them as T3 and T4. Basically, I lost my slide here. Where am I at? Okay. So they're the thyroid hormones. And basically they get released when TSH is released, triggers them, they're released in the bloodstream. The job of, and what you also have to understand is, what is the job of this hormone? What is it? Each hormone has a function. So when you're studying, thyroid hormone regulates metabolism, body temperature. So it's going to be released is basically metabolism of the carbs and lipids. Like if you know people that are hyperthyroid and they're typically skinny, or they can eat whatever they want. We usually hate them because they can eat whatever they want. I mean, my son can whip down, I think he's even had a triple Whopper once, but the kid's like been like 175 6'4", like, you know, so some people just have a higher metabolic rate. They're going to burn through calories, where people that are hypothyroid, and even animals that are hypothyroid, tired, slow, put on weight easy. So metabolism is related to how does your body use carbs, lipids, metabolize proteins in the body. And so, and also temperature. So it helps maintain that temperature. So sometimes people that are hypothyroid tend to be cold, more cold. Now the other thing, and I don't know why I didn't have this on here. I'm sorry. Let me add one hormone here. Calcitonin. Calcitonin. Now, this is where people get also confused on the test. Calcitonin is produced in the actual thyroid gland, and what happens is it's basically preventing hypercalcemia. So when calcium levels are high, maybe the animal's getting supplemented with calcium, too much calcium in their diet, it's going to take calcium and it's going to move it into the bone. So it takes it out of the blood and puts it into the bone. On the flip side of that, I have, next to this, I have parathyroid hormone. Now there are parathyroid glands. So parathyroid hormone, or PTH, is not produced in the thyroid. It's paired next to the thyroid, but it does the opposite. It's if the calcium's low, it tells the target is the kidney and the target is the intestine, but it'll basically try to get the kidneys to retain calcium. It'll try in the blood, it'll try and do the same thing in the intestine, try to pull more calcium from the diet to raise calcium, and an extreme pull from the blood. So, or from the bones. It can pull calcium out of the bones to move it into the blood. Now, the adrenal hormones, now remember, there's something important, and I don't have it on this homework, but you've got the adrenal gland, and the primary one that I'm talking about. Now, remember, the adrenal gland is similar to the pituitary. It looks like one gland. It's two structures. It's a cortex and a medulla. But when you look at it on the outside, it looks like one. So remember, which ones are a gland that has two parts? The cortex produces hormones and the medulla produces hormones. So the cortex produces the corticoids, the primary one being cortisol. Cortisol, glucocorticoids. The primary mineral corticoid is aldosterone, which regulates electrolytes. So the regulation of electrolytes and the regulation of cortisol has a lot to do with stress. When I think of the adrenal gland, I think of stress. You have to have a functioning adrenal gland to maintain fight and flight. And then you have, in the medulla, primarily produces epinephrine and norepinephrine, which we know are the primary hormones. So cortisol, norepinephrine, and epinephrine are your fight and flight. Aldosterone is more of your electrolyte levels. But again, electrolyte levels are key for cellular function. So we're not going to be able to process stress if we don't have adequate levels of these hormones. The other one on here, insulin, which is part of the endocrine pancreas. And then you've got your, basically insulin lowers blood glucose. And then I've got glucagon, which raises blood glucose. So glucagon is a hormone that triggers the glycogen to be converted to glucose. And remember, glycogen, you got glucagon, glycogen, glucose. I can't spit all that out. Glucagon stimulates glycogen to be changed into glucose. And glycogen is stored glucose. It's your leftovers. So when the animal's not eating, can access that. But insulin basically takes sugar from the blood after a meal, any glucose, and it moves it into the cells. If an animal is insulin deficient, which is diabetes, then what happens is the glucose from the meal is not, the cells can't use it. So you have these elevated blood glucoses that, upwards to the 200-300 range. Insulin's not supposed to be in the blood. I'm sorry, glucose is not supposed to be in the blood, or a certain amount is, but it's really supposed to be moved into the cells. And a little tip, when you guys do urines, you test for glucose in the urine. It takes about a glucose of over 300 before it shows up in the urine. So by the time you have a positive glucose on a dipstick, you know that in the blood it's at least 300, at least. Usually at home, some owners will buy the little glucometers and they can prick a paw pad. But most of the time we give them urine sticks and they dip their dog's urine in the morning. And as long as they're not showing glucose in the urine, we know they're probably under 300. And that's one easy way. It's much easier for an owner to do that than to try and deal with blood and a glucometer. And then I talked about the testicles and testosterone, which is the primary male hormone. And then in the female, so the testicles produce testosterone. Now remember, if an animal is spayed and neutered, if we neuter a male, we're taking away their primary sex hormone, which is testosterone. The adrenal gland still produces some sex hormones because some of those hormones are needed for basic body functions. Not that they don't need to stay intact to have that happen, but they're going to get some production. But the majority, again, when you spay a female, you're going to take away the estrogen. When you neuter a male, you're going to take away the testosterone. Okay. And then it says for number 13, why is erythropoietin so essential? What if an animal cannot produce this? So erythropoietin is needed to maintain red blood cell formation. And if an animal cannot produce erythropoietin in the kidney, what's going to happen is red blood cells start to die. The animal may become anemic. So again, you see these anemic cats now you can have a cat that's anemic and the kidneys are fine. Cats, especially kittens, sometimes get flea bite anemia. I sometimes see little kittens, they're overloaded with fleas, and that's an issue with the fleas. It's, the fleas have consumed too much blood and the body can't reproduce, because it's being consumed. So again, anemia is think about anemia like an umbrella. There's this big umbrella, and underneath the umbrella are all the different reasons. So when you get a blood test back and it shows anemia, now, again, there's going to be some red flags. If I have a little decrepit 16-year-old cat that's anemic, I'm thinking renal failure. If I have a kitten loaded with fleas, I'm thinking flea bite anemia. If I have a cat who was hit by a car, probably a ruptured spleen. So there's other things that clue you into the reason. Anemia is just so broad. Okay, do you have any questions? I think, because the rest of the hormones I kind of talked about. Hopefully I went through all those answers. I'll get this recorded. I will send you those extra handouts. And then I will talk about the timing for the test, the quiz tomorrow. I always say it'll be, again, it's just over the endocrine system. Okay, if there's no questions, you are free to go, and I will see you guys tomorrow. Have a good day. You too.
Hey, Mrs. Landros, it's
Yes.
Sean.
Hi.
When I was talking about relaxing, I was talking about, after all that labor and all that birthing, you need that relaxing.
Oh, heck yeah. I thought you were talking about all your labor over in the kennel. You need to do some relax.
Yeah, but no, I was more referring to, being a mom. We went, after you go all through that, it's like, heck yeah, I need to relax now, man.
Oh my gosh. I was kind of sad when they were like, you have to leave the hospital. I'm like, no, really, I should probably stay a couple more days. They're waiting on you.
I had a lot of family that came in. I was out of state, so family came in to help me. And I had a C-section, so I couldn't go upstairs. I had to sleep on the couch. So I was always napping when I could. I took that line seriously.
Yep. I was like, take a nap, take a nap. It's funny because I feel like I'm going back through that with the puppy. It was like he took a big nap the other day and I wasn't as tired, but I was like, he's going to be up. He's sleeping better like he's pretty much sleeping through the night now, which is good. But
Yeah.
damn, I was like, gotta go to bed. You gotta go to bed.
Yeah, I totally do not miss having